Our next presenter for this session is Stephanie.
Hi, my name is Stephanie, and today I'll be presenting on how does job satisfaction impact nurse retainment. So for this PICO, the population is nurse staff, the intervention is job satisfaction, the comparison is none, and the outcome is nurse retainment. So in the last decade, there has been a steady increase in nurse demand with hospitals trying to keep permanent staff on for as long as possible. However, people who oversee the hiring of nursing staff in general sometimes forget the importance of looking into turnover rates. Just in the last 6 years alone, these turnover rates have varied from as low as 8.8% to 37% in certain regions, and a national average of 17.1%. So that's a little over 700,000 nurses in the US alone. And even with the steady growth of new nurses entering the field, there is no positive changes being made to help lower these statistical numbers. So some of the articles that I have compiled for this research goes more in depth into the importance of nursing satisfaction and to find contributing factors that are impacting nurse retainment. So for my first article, the interrelation between nurse to patient ratio, nurse engagement, and missing nurse care in Kingston Medical City. This research was a cross-sectional analytical study, and the purpose was to investigate if nursing statistic was impacted due to patient to nurse ratio. And it was also used to compare nurses satisfaction categories and missing care categories across different hospitals. The population that was used was 384 nursing respondents from maternity and pediatric departments. And the method that was used, it was divided into two sections. And the first section was a regular engagement satisfaction survey using a 1 to 5 scale, and 1 being very unsatisfied and 5 being very satisfied. And then for the second portion of the survey was that it was done into 24 questions, and it was divided into 4 different sections. So some of the sections that I have noted here was the missed opportunity for patient assessment, missed individual needs intervention, missed basic need interventions, and missed planned interventions. And I've posted here some of the results, and it shows here that 9.1% felt very satisfied, 40% felt satisfied, and 32.3% felt neutral, with it being very low for the 4.4%, which felt very unsatisfied. So some of the limitations that I came across was that most of the participants were solely based on maternity and pediatric department. And there wasn't really inclusivity for med surg, ICU, and the ER department, which we all know has a higher patient acuity rate. So with that being said, the nurse to patient ratio and missed care was not a big negative factor for nursing satisfaction. The next article is the association between care left undone and temporary nursing staff ratios in acute settings. So this research was a cross-sectional analytical study, and the purpose was to see the effects of care left undone due to the shortage of permanent hospital healthcare workers, the effects of understaffing in a high patient demand hospital, and the effects of hospital contracting temporary staff to fill those permanent spots. The population that was surveyed was 8,841 staff members who worked in acute adult settings such as ER, critical care, adult acute, geriatric care, and the operating rooms. So the method that was used was first they used the planned nurse, they used the planned nurses versus actual nurses on the shift, and then the permanent versus temporary staff. And then at the end of each shift, they would compare to see if they were able to complete care. And then after that, the quality of care that was actually given was rated on a scale from 1 to 5, with 1 being unsatisfied and 5 being very satisfied. The results show that in the ER, 48.4% care left undone with low satisfaction, and the OR showed 21% care left undone with low satisfaction. And the temporary staff made up about 10% of the hospital workers in this hospital that was surveyed. And about 6% of those temporary workers agreed that a lot of care was left undone per each shift. Some of the limitations that I came across was that not a lot of study or control we're seeing it for these variables besides just temporary and permanent staff, as well as not including things like hours worked, workload, or shift, which differs in care left undone between day and night shift. So overall, the relationship between both understaffing and high levels of temporary staff resulted in increased care left undone as opposed to permanent staff with less temporary staff. For my next article, we have the nurse assertiveness on physical, task, monetary benefits, and critical success factors with exceptional position to potential skill development in multi-specialty hospitals. This research was a systemic review, and the purpose was to examine the effects of physical facilities, task factors, and monetary/non-monetary benefits on nursing satisfaction, and also to examine the critical success factors of nurses in relations with competitive nursing skill development. In order for them to obtain this population, they had to divide it into 3 different stages. And so for the first stage, they used a researcher chose 5 cities based on the highest number of multi-specialty hospitals. And the second stage, each nominated city using random techniques were selected as cluster units according to the proportion of the population. And then for the third stage, from the selected cluster, the sample size of 750 nurses were randomly selected based on the results from the existing nurse population using a sample calculator. Now, the method that was used was a little complicated, but just bear with me. The survey that was conducted was 9 different survey methods, but for the purpose of this topic, we're only going to use 2 that were relevant to this research. So each participant rated category from highest priority to lowest priority using a number scale of 1 to 10, with 1 being the highest priority and 10 being the lowest priority. The first research was the physical facilities, task factors, monetary and non-monetary benefits. For the physical facilities, that entailed more like patient equipment, dress changing rooms, cafeteria, lighting, ventilations, and intercom facilities. And for the task factors, that was more freedom of work, workload, training programs, career growth opportunities, and job satisfaction. And for the monetary, non-monetary, it's pretty self-explanatory. It was salary, overtime, leave salary, work flexibility, and of course, medical benefits. Now that was just the first research. Now the second research that was used was the critical success factor, which covered the importance of introducing the latest technology, participations in patient care, opinions heard, and used to enhance patient care and nursing job satisfaction in each facility. Now, the results for the physical, task, and monetary benefits, we see that their highest priority for the physical facility was patient equipment availability. And then for the least priority was the intercom facility. And for the task factors, the highest priority was job satisfaction, and the lowest priority was freedom of work. And for the monetary, non-monetary benefits, the highest priority was salary allowance and and the least priority was work flexibility. Now, for the critical success factors, their highest priority was the introduction of the latest technology, and the lowest priority was the participants and patient care decisions. Some of the limitations that I actually came across was that the research factored in too many variables from lighting to ventilation in order to determine skill development in nursing and satisfaction, which was a little hard to interpret. Overall, there was a close significant relationship between the work satisfaction level of nursing and their facilities, with 312 participants being satisfied with the overall quality of their hospital and 165 participants being unsatisfied with the quality of the hospital. For my next article, Job Satisfaction and Career Intentions of Registered Nurses in Primary Healthcare. This was a systemic review, and the purpose was to see the study was conducted to see if there was a steady increase or decrease in job satisfaction over the past decade. The study can help determine if changes are needed to be done to retain nurses in their current job settings. So this population was anywhere from 31 to 1,044 participants. And the method that was used was they took 20 articles and that were studied to conduct their research of the quality of satisfaction from the year 2000 to 2016. This was also a qualitative research that was used for each article from very satisfied to very unsatisfied. The results show that from those 20 articles, only 50% of the nurses remained very satisfied to satisfied with their work environment, while the other 50% of the nurses were a mix of neutral to very unsatisfied. And the main reason for the 50% feeling neutral to very unsatisfied was due to nurses feeling unheard or feeling undervalued, with half of them not intending to stay permanent at their current jobs. Some of the limitations that I came across was that when comparing some of the surveys from over the years, many did not use the same survey tool or measurements. So it was kind of hard to understand. Overall, there was no change that has been made in the past 16 years to ensure nurse retainment, which can contribute to nurses leaving and feeling unsatisfied with their job environment. Now, for my last article, hospital staffing and local pay, and an investigation into the impact of local variations in the competitiveness of nurse pay. The research design was a crossover study design, and the purpose was to investigate the competitive pay of nurses in the France area. And it was also used to determine if pay is solely based on the area of the hospital rather than the market pay. The population that was used was researchers took about data from over 3 years, from 2006 to 2008, and compared among 2,848 public, private not-for-profit, and private for-profit hospitals. And the method that was used they took the data and measured from highest wage to lowest wage and took the average to determine if the pay increased in the area. The results show that the study concluded that both the public and private hospitals had similar wages and little to no competition, making it hard for people to actually stay as staff. So some of the limitations that I saw was the data was not in the United States based, so it can be hard to determine if pay in the United States has similar results. Overall, in order to help retain nurses and stay competitive, offering a higher wage than other hospitals can appeal to more nurses and ensure longer retainment. Overall, the articles compiled helped in answering the question about how job satisfaction does in fact impact nurse retainment. And the articles presented also help sum up the common things nurses want, and that's for better staffing, better work environment, benefits, and wages. Although obviously not all can be met, depending on the areas, it is without a doubt that each article had one thing in common, and that was that everybody wanted to have their opinion heard. Especially during the era of COVID, listening to feedback and opinions can be a step in the right directions to help with nurse retainment. These are my references. Do you have any questions? Yeah. I think it's seen a lot in temporary staff because of the constant adaptation in their environment. So a lot of times it can be because they don't know the requirements or the guidelines that is required in each hospital. So sometimes that's why temporary staff has a lot of work left undone. Good question. Anybody else? Thank you.